Just doing the okay. So today I'm going to do a head-to-toe assessment. So I'm going to wash my hand and I'm going to clean my stethoscope and put my gloves. Okay, so hi Dennis, I am Jane, RPN student at Seneca College. I am going to do a head assessment on your head to toe, and this one it takes like 30 minutes. So would you like to go to the washroom before we start?
No.
Okay, thank you. And this one will include me touching you. Are you okay with that?
Yes.
Okay. And can I check your armband, please? Thank you. And let me just check if you are comfortable and then put the curtain for privacy. So before we are going to start, I just want to ask you like a 3 question. Are you taking any medication?
No.
Any allergy?
No.
Any pain?
No.
Okay, thank you. So Dennis is a Caucasian. He is white and he appears to be same age as what is stated. He is 55 years old, and his body structure is between normal, no odor, no involuntary movement, no physical deformities, and he looks healthy, no sign of obesity, and maintain eye contact. He well dressed, so appropriate weather, looks relaxed, and no sign of distress. His speech is clear. So now we are going to check your mobility. So if you can walk from here to there and back. Okay, thank you. The balance is good. And now I'm going to check on your breathing. So no signs of shortness of breath. And now I'm going to inspect and palpate your head. So head is round, and I'm going to just palpate and let me know if there is any pain. Is there any pain?
No.
No pain, no bumps and lumps, no head is symmetrical, and here is the dark brown and no lice infestation, and same client wash his hair 3 times. How many times you wash your hair in a week?
3 to 4 times.
Okay, so client wash his hair. Nice. So now I'm going to inspect your face. Face is symmetrical with no involuntary movement. I'm going to just touch your face. Is there any pain here?
No.
No pain, and no skin pigmentation, no lesion, and no scar, and no swelling. So now I'm going to test the cranial nerve 7, which is the facial. So if you can smile, thank you. Can you show me your teeth? Okay. Can you frown? Can you lift your eyebrows? Okay, there's here. Okay, shut your eyes tight, right there. Okay, and puff your cheek. Okay, so no nerve damage. Face is symmetrical. So now I'm going to check on your eyes, which is I'm going to check your eyelashes and eyelid, which is evenly distributed, and the eyelid close when the eyelid met when the client close his eyes. And if you can tilt up your head so I can check your sclera. Sclera is white and conjunctiva is pink. And I'm going to do the same thing in the other eye. And now I'm going to check on the cranial nerve 3, which is the oculomotor. So I'm going to put light in your in your eyes so I can check. Pupil is equal and round, and I'm going to check check your consensual I'm going to check the consensual to light. So I'm going to put a light in your eyes if your other eyes will constrict. So if you can look straight, look straight. Okay, the other one is constricted. Other one is constricted. So the eyes is reacting to the light. So now I'm going to check on your accommodation. So if you look straight and look at this pen. Okay, both eyes constricted. So pupil is equal, round, and it's round and reacted to light. The size 4 and accommodation. And now I'm going to check your cardinal gaze. So I'm going to if you look straight and you just follow the pen with your eyes, don't move your head, okay? Okay, so gaze is normal and no nystagmus. So now I'm going to check your cranial nerve 2 using the confrontation test. So if you are going to cover your one eye and tell me if you are looking double vision.
No. No. No.
Okay, can you do cover the other one and we'll do the same one thing?
No. No. No.
Okay, the confrontational is good. And now we are going to do the Snellen chart. Since my client is above 45 years old, so we are going to do this one. So if you can hold this one and let me know if which. Oh, do you wear glasses?
No.
Okay, so if you can cover your other eye and read which one, how. Okay, a little bit farther and let me know which one you can read in there.
63925.
Okay, and then do that with the other eye.
63925.
Okay, so this is the one that you can read. So that is like 20/50. Okay, thank you. And now we are going to check on the we are going to check on your ears. I'm going to inspect on your ears. So ears, pinna is intact and no discharge. So I'm going to palpate your so it's the same with the other ears. So I'm now going to palpate your auricle and let me know if there's any pain. Okay, is there any pain in here?
No.
Okay, no pain and no tenderness. And I'm going to palpate the tragus. Is there any pain in here?
No.
Okay, that's good. Thank you. No pain on the no pain. And now I'm going to do the whisper test. So it's a I'm going to whisper 3 words and repeat after me, okay?
1, 2, 3. A, B, C.
Okay, so both ears can hear. And now I'm going to test the cranial nerve number 8, and I'm going to do the Weber test. So I'm going to put this one on top of your head and tell me if you can hear on both your ears, okay? And say now if it stops the sound.
Yes.
Okay. Can you hear on both ears?
Yes.
Okay, client can put on both ears. So I'm going to do again the Raynaud's test. So I'm going to put this on your mastoid ear, and let if it stop if the sound is stopped, say now.
Now.
Okay. And
Now.
can you hear on the both?
Yes.
So bone and air conduction are the same, and you can do also on the other ears. So now I'm going to do the I'm going to put a light in your ears to check your external auditory canal and the tympanic membrane. So since my client is adult, so I'm going to pull up the pinna and back. Okay, so I'm going to check your and pull up in back. Okay, tympanic membrane is clear and no discharge. External auditory canal is clear and no discharge. The tympanic membrane is shiny and grayish. Okay, thank you. And so now I'm going to that's one is cranial Weber test, and that's the and now I'm going to do the oh, that one I did already. Cranial nerve 8, I did already that. So now I'm going to inspect your nose. So I'm going to do nose is midline, and if you can tilt a little bit so I can see inside. Inside is grayish. So now I'm going to palpate your frontal sinus and let me know if there's any pain.
No.
Okay, and the maxillary sinus, is there any pain?
No.
Okay, so no pain on both. And now I'm going to test your cranial nerve 1, which is the patency of smell. So if you can close your eyes and tell me what you smell.
Coffee.
Okay, thank you. And close your eyes. And
Vicks Vapo.
okay, that's good. Thank you. So both nose can smell. And now I'm going to go in and inspect your mouth. So put it in here. So I'm going to inspect your lips. No fissure. Lips is no fissure, and no bleeding, no swelling. And can you open? Can you show me your teeth? Teeth is white, and all teeth are all present, and gums, no bleeding, um, and pink, and can you show me your? I show the tongue, and the base of the tongue. The tongue is pink. The base of the tongue is pink, and hard palate is whitish. And the soft palate is pink. Okay, so now I'm going to inspect and the hard palate, no lesion. And now I'm going to inspect your cranial nerve 9, and then in the cranial nerve 10, which is the glossopharyngeal vagus. So if you open your mouth and say ah, and okay, so soft palate is moving. Can you say ah? Ovula is rising. Okay, thank you. So now I'm going to check on the cranial nerve 12, which is hypoglossal. So if you can stick your tongue and move from side to side, and can you say light, tight, dynamite? Okay, so tongue is midline and can move from side to side. So now I'm going to inspect your neck. So if you can, okay, neck is midline, and if you can tilt up a little bit so I can see your trachea. The trachea is midline and is straight, and I can palpate your. I will palpate your carotid. Okay, let me see if there's a thyroid enlargement. No thyroid enlargement, and so now I'm going to palpate your carotid artery. Okay, and the other one. So rhythm is regular, and the pulse is strong. So now I'm going to test the cranial nerve 11, which is the spinal accessory. So if you can rotate your head, and then I will put my hands. So I will go against it. So, okay, and you rotate the other side. Okay, so client can rotate the head against the pressure. So yeah, I'm going to put my hands on top of your shoulder, and you can shrug it. Okay, so client can shrug the shoulder with the against resistance. So now I'm going to now we are going to test your integumentary and musculoskeletal system. So I'm going to inspect your upper extremities. So hands is symmetrical and no involuntary movement. Hair is evenly distributed and no lumps, no bumps, and can I check your nails, please? Nails is pink, and when I press, the nail capillary refill is 2 seconds, and no clubbing. Both hands are same, and now I'm going to palpate. Okay, so let me know if there's a pain. Is there any pain?
No.
Okay, so no pain. Any tenderness?
No.
No sweat, no edema. Okay, so now we are going to test for the RON. So let me know if you feel pain, and we are going to do the for the finger. If we can do, if you follow me, it's just the finger. So we do flexion, extension, and now we are going to do the wrist, which is the wrist. So we were going to do the flexion, extension, and then we are going to do the ulnar and radial deviation. So ulnar and radial deviation. Okay, is there any pain?
No.
Now we are going to do the elbow flexion. We are going to do first the elbow flexion, extension, and now we are going to do the supination and pronation. So pronation and supination. Okay, thank you. And now we are going to do the shoulder. So if you can shrug your shoulder, and when we are going to do the abduction and adduction, abduction, adduction, and now we are going to do the internal and external rotation. So internal, external. Did you feel any pain?
No.
So no pain and no crepitus and no altered ROM. So now I'm going to palpate the radial pulse. Can you give me your hands? Okay. Radial pulse is strong and regular in rhythm. And okay, we're going. Thank you. And we are going to do the test hand grip. So if you can squish my both hands. Okay. Patient hand is strong and it can squish my hands equally. So now we are going to I'm going to inspect your lower extremities. Okay, so lower extremities is no swelling, no edema, no lesion, no involuntary movement, no deformities. And now I'm going to palpate and let me know if there's any pain, okay? Is there any pain?
No.
No pain. And legs are warm to touch, no sweat, and no tenderness. Okay, so now I'm going to palpate your dorsalis peris. So if you can sit in here for a bit, so I can palpate your dorsalis peris. Put your feet here so it can be seen in the camera. Only one. So okay. Is there any pain in here?
No.
Okay. Dorsalis peris +1 is slightly strong. And now I'm going to palpate the tibial pulse and the posterior tibial pulse. Okay, it's +1 and weak. Okay, so if you thank you. So if you can come in here, so we will I will inspect your thorax, posterior thorax. So okay, is no skeletal deformities, no cyanosis, a little bit mole in here, and no scar, and ATP ratio 1:2. So now I'm going to palpate your posterior thorax and let me know if there's any pain. Okay, so if you can so I can see in the can you stand a little bit so I can, okay, so okay, and if you can if you breathe, take a breath. Is there any pain?
No.
Okay, no lesion, no tenderness, no pain, and warm to touch, and no sweat. So now I'm going to palpate for tactile fremitus. So if you can cross your hands, and every time I'm palpating you, and you say 99. 99.
99.
Can you say it louder?
99.
99.
99.
So okay, symmetry.
99.
Okay.
99.
So it's a symmetrical expansion. It's normal and no pain. Now I'm going to percuss. I'm going to percuss. Okay, so it's a resonant sound from the thorax. So now I'm going to auscultate the posterior thorax. So I'm going to auscultate the bronchovehicular okay, loud sound, no extruder. And now I'm going to auscultate the vesicular breath sound. Okay, sound is softer and no crackles or whizzing sound. So I'm going to auscultate all your posterior thorax. Can you take a deep breath? Deep breath. So no crackles or whizzing sound, and there is a good entry of air in all lobes. So now if you can turn around so I can we can do the face a little bit here, so we can do the I'm going to auscultate your aortic, and that's what now I'm going to do the thorax cardiovascular. So I'm going to do the aortic, which is in the that is the right first intercostal space. That's the right. Can you take a deep breath? Okay, and the pulmonary, which in the second is intercostal space, and the tricuspid, which is in the fourth intercostal and the third intercostal space. Take a deep breath. Okay, and the earth point, take a deep breath, which is in the fourth intercostal sternum. And then now I'm going to put in the mitral left five intercostal space. So I'm going to auscultate S1. S1 is louder at the apex of the heart, and the S2 best heard at the base of the heart. And heart sound in S3 and S4 is no abdominal sound and no murmur. Okay, so now if you can lay down in here. So I'm going to so I'm Yes, if you can lie down there. So I'm going to inspect your abdomen. So abdomen is flat. Umbilical is no protruding. Let me a little bit put the and no lesion and no scar. So now I'm going to auscultate for the four quadrant. So I'm going to okay. The upper right quadrant and the upper left quadrant and left upper quadrant. So it's no vowel sound heard. So now I'm going to auscultate broid sound. So now I'm going to use the small bell, which is I'm going to hear the aortic one. Okay, if you can okay, and the renal, and then the iliac, and the femoral. Okay, so broid sound is normal. So now I'm going to percuss your abdomen in all four quadrant. So I'm going to palpate. Is there any pain?
No.
Okay, so there's no pain, and now I'm going to percuss. And that is a tympanic sound. Can hear a tympanic sound. So now I'm going to so now we are going to I'm going to do the Morphy sign. So I'm going to put my hands and curve it and let me know if there's any pain. Is there any pain?
No.
And then I'm going to put my finger and curl it and let me know if there's any pain.
No.
Is there any pain? Okay, no pain. And now we're going to it's my thumb. I'm going. Oh, okay. Now I'm going. It's my thumb, and then now I'm going to perform the rebound test. So if you can come back and we're okay with that, thank you. So now if you can come back and sit in here, so we will perform the rebound tenderness test, the Bloomberg. So if you can give me your finger and your thumb, so close your eyes and let me know up or down.
Down. Up.
Okay, so fingers. Is there any pain?
No.
Okay, so no pain, and I'm looking at the client's face and there's no reaction. So now I'm going to thank you. I'm going to perform the neuromuscular function. So I will I will assess the sensation of the arm, hand, and legs. So close your you still close your eyes, and let me know if it's a dull or sharp. So is it sharp or dull?
Dull.
Sharp or dull?
Sharp.
Okay. Sharp or dull?
Dull.
And then your feet, sharp or dull?
Sharp.
Okay, and I'm going to give you something and let me know if it's soft or it's hard. Okay. Can you touch that?
Soft.
Okay, thank you. So now I'm going to do the stereogonals. Still close your eyes and stereogonals test, and let me know if what is this. Hold it and let me know what is it.
A coin.
Okay, thank you. So that's good. And now I'm going to assess the deep tendoid reflex. Okay. Okay. So. Okay, that's plus 3. Now I'm going to do the tricep. Okay, that's 3, and now the brachial. Okay, so the other one is, so that's 3, and then I'm going to do the patella. Okay, that's 2. Now I'm going to do the Achilles. If you can, so I can do your heels. Achilles. Okay, and that one, and then if you can sit again in there, so I'm going to do your plantar, and then so we can put your feet here. Plantar is okay, so the feet is curling when I'm doing the plantar. Okay, so now I'm going to thank you. So now I'm going to assess your neuromuscular function. So where you are going to walk on your 2, so I can see your balance. You can walk on your 2, on your heels, and if you thank you. So the balance is good, and if you can stand and so I'm going to check your Romberg's test. So if you can stand and put your feet close together and close your eyes. Okay, so Romberg's test is good. Okay, thank you.